after accidents, when we go through MRI reports and start treatment plans. And many times they'll talk to me and the medical doctor. Medical doctor I work with is a interventional pain management, interventional spine and pain. Just it works in that specialty. And many times, we'll intake a patient together, start very conservative work with the person, and maybe get some MRI results back and check in with the patient. And there's always kind of a couple of things going on. Number one, either the patient has already seen really good improvements depending on a lot of different factors. By the time we get their MRI results, go over them with the medical doctor. Medical doctor says, hey, these are some things that we are seeing on these films or MRIs. Good chance all this stuff was present beforehand, just got irritated by the accident. You're already improving with conservative management, so we'll just carry on. Okay, patient's like, fine with that. Typically, the outcome is great in a few more weeks. Another version of this is patient tells me after a few weeks, not improving. And then we have another appointment with the medical doctor going over imaging, things like that. And medical doctor may say something like this. It's come to my attention that, after discussing with Dr. Travis, that we're not seeing some of the improvements that we would expect at this point. We got your MRI results, and X, Y, and Z is going on. Again, may or may not be caused by the accident, but these are some of the things we're seeing on imaging that could still be related to your continued symptoms. And if we're not getting the relief we want from conservative management, here's another list of different things that we could try that are a little more invasive. Some sort of Physicet injection, epidural steroid injection, radiofrequency ablations, medial branch blocks, things of that nature. And a lot of times what's interesting is this kind of takes one or two paths depending on the psychology of the patient. What we'll see more often than not, this is kind of how you end up down this road of, if anyone ever does need something more invasive. But once we have that conversation with people, there's like a split. There's a split. And a lot of times the split, more often than not, the split goes the direction of the patient says, okay, thanks for that information about possible future treatment options if I'm not improving. And then they just continue down, because anyway, even if we are going to do something more invasive, that takes time to approve and all that stuff. So there is still time after that discussion before anything could even be done. And many times that patient, the psychology of them is, oh, okay, I'm not improving as fast as they think, but a lot of these things had been probably a problem, or a lot of these things were probably present before the accident. I don't really want to subject myself to further, more invasive treatment options. So then you start to see this mind shift in them. And many times what ends up happening is we have that discussion with them about more invasive procedure options. And a week or two later, they're like, oh, I feel great. Everything's working great. I'm back to normal, all that stuff. In the rare instances that those patients will turn around and still say that they're not improving, and then opt for some other more invasive option. But in the end, it's just kind of an interesting little insight into the psychology of the patient, and seeing how far are they willing to go to make an improvement. And many times when they're faced with the option of, you will probably continue to improve with these conservative measures, or we can do some of these more invasive therapies, a lot of times the patient's mind shift will switch towards, okay, I don't want to do anything more invasive. so I'm going to stick with this. And then we start to see improvements because a lot of times it's because they are trying to avoid doing something else that they don't necessarily want to do. So just kind of some interesting insights into how patients can think and how when you're presenting them with choices, how a lot of times their uh, their aversion to wanting to do some sort of injection or something more invasive creates a mind shift that helps their outcome improve in the more conservative manner. So, hope that's kind of an interesting point of uh, conversation for you guys. There's tons more on my YouTube channel about lots of these topics, so go take a look and see you later. I'm a chiropractor, so kind of a doctor, I guess.